Welcome to the Omnidental Podcast.
It's great to be here.
We're doing something a little different today. We are taking a deep dive into a topic that, if I'm being honest, usually triggers one of two reactions in people.
Fear or avoidance.
Exactly. Total fear or complete avoidance. We're talking about full versus partial dental implants.
Which is completely understandable. I mean, I don't think anyone wakes up on a beautiful Saturday morning and thinks, you know what I'd love to do today? Research oral surgery.
Right. It's the thing you put off until you absolutely can't anymore. But here's the thing, and this is why we wanted to tackle this. If you ignore it, the consequences, they aren't just about having a gap in your smile.
Not at all.
We're looking at sources today that frame this not just as a dental procedure, but as this massive quality of life issue. It's about engineering, it's about structural integrity, and really it's about restoring what was lost.
That is absolutely the right way to frame it. If you look at the sources we have today, specifically the insights from Dr. Bola's polls and the philosophy behind Omnidental and MedSpa, you realize that losing a tooth is, it's actually a systemic issue.
A systemic issue, not just a cosmetic problem.
Right.
Okay. Let's unpack that right away, because the source material makes a really strong point right out of the gate. Losing a tooth changes everything.
It really does. It changes how you eat, how you speak, how you smile. But beneath the surface, it's doing something even more critical. It can lead to bone loss. This is the part people just don't realize.
Bone loss.
Yeah. When a tooth is gone, the jawbone doesn't have that pressure or stimulation anymore. It's a classic use it or lose it scenario.
So the body just decides, okay, I don't need this bone anymore.
Essentially, yes. It starts to recede. So when we talk about implants, we aren't just talking about filling a hole. We're talking about maintaining the actual structural integrity of your face.
And that's where today's deep dive comes in. We have these detailed breakdowns from Dr. Poles, who has, over a decade of experience?
Over a decade, yeah. Specifically in trauma and emergencies.
So our mission today is to, demystify the scary world of dental surgery. We want to explain the mechanics of how modern dentistry can basically create a second act for your mouth.
A second act. I like that. It implies the story isn't over just because you lost a tooth.
I try. But first, let's set the stage properly. Who are we actually learning from today? We're looking at Omnidental and MedSpa. Yeah. And they aren't just some faceless corporate clinic. They're located at 305 E Rand Road in Arlington Heights, Illinois. And the vibe I'm getting from the reading is very much trusted family practice, but with some serious tech behind it.
It's an interesting blend, isn't it? Usually when we talk about high-tech implants, we think of these cold clinical hospitals. But Dr. Bola's poll seems to bridge that gap. The source says he has over 10 years of experience, but it specifically highlights his work in treating injuries and emergencies.
That stood out to me, too. If someone specializes in emergencies, you know they have to be precise. You don't have time to second-guess yourself in a trauma situation.
Exactly. It implies a steady hand and an ability to think on your feet. And the philosophy described in the text is a patient-first mentality. It says they focus on overall well-being, not just the teeth.
The holistic view.
It is. And this is a detail I found fascinating. They are committed to being environmentally conscious.
Wait, really? An eco-friendly dentist? I feel like I've never even heard of that before.
It is rare. Dentistry traditionally produces a lot of waste plastics, chemicals, but Omnidental apparently uses sustainable practices without compromising safety. That's a very specific, thoughtful layer to their whole model.
It tells you they're thinking about the details. If they care about the environmental footprint of the clinic, they probably care about the microscopic details of your surgery.
That's a fair assumption. Attention to detail is attention to detail.
And speaking of their footprint, while they're based in Arlington Heights, they're serving a huge chunk of that area. I've got the list here, and it's extensive. Buffalo Grove, Palatine, Mount Prospect.
Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
So basically, if you're anywhere in that northwest suburban pocket of Illinois, Dr. Poles is the expert you want in your corner.
Exactly.
Okay, so we've established the expert. Now let's get into the nitty-gritty. What exactly is a dental implant? Because I think a lot of people just assume it's a fake tooth glued in there, or maybe they confuse it with veneers.
Yeah, it's definitely not glue, and it's very different from a veneer. If we wanted to de-jargon this, just think of an implant as an artificial tooth root.
An artificial root. Okay, so we are replacing the anchor, not just the visible part.
Correct. It involves surgically inserting a post, it's usually made of titanium, directly into the jawbone.
Titanium? That sounds intense, like something out of an aerospace lab. Why titanium?
It's the gold standard in medical engineering. And here's where it gets really cool, biologically. Titanium is biocompatible. So the source describes a process where the bone actually bonds to the titanium.
So the body doesn't reject it, it accepts the metal.
Yes, it's called osseointegration. The bone cells literally grow into the microscopic surface of the post. It integrates. This creates an incredibly sturdy base. And once that happens, you can attach crowns, bridges, whatever you need, and they aren't going anywhere.
Which brings us to a huge benefit mentioned in the guide. Unlike, those old school dentures, the ones that sit in a glass of water at night, these are fixed.
Completely fixed. They don't slip, they don't click when you talk. And because they connect to the bone, they provide that stimulation we talked about. They transmit the force of chewing into the jaw, which signals the body to keep that bone dense.
You're essentially hacking the body to think the natural tooth is still there.
That's a perfect way to put it. It's biohacking.
Okay, so that's the basic mechanics, but the title of this deep dive is Full versus Partial. So let's break that down. Let's start with partial dental implants. What's the scenario here?
The scenario for a partial is preservation. You still have healthy, natural teeth remaining. Maybe you lost a couple in an accident or decay took a molar or two, but the rest of your mouth is in good shape.
So you don't want to rip everything out just because of a few bad apples.
Absolutely not. The goal of a partial implant is to fill the gaps without disturbing the piece, Instead of replacing everything, Dr. Poles would place a limited number of implants to hold replacement teeth securely in those specific spots.
And the source mentions this often supports a fixed bridge.
A fixed bridge or implant-supported dentures, right?
Mm.
And here's the crucial comparison the source makes. Think about a traditional removable partial denture. How does that usually stay in?
With those little metal hooks, right? They kind of latch onto your other teeth.
Exactly. They use your remaining healthy teeth as anchors. Over time, that constant pressure and torque can wear down the enamel and actually loosen the healthy teeth.
So those hooks can actually damage your good teeth.
They can, but partial implants do not rely on hooks. They're independent, they stand on their own titanium roots, so they protect the surrounding teeth because they don't need to grab onto them.
That's a huge distinction. So it feels more natural, it's more stable, and it saves the teeth you have left.
Ideally, yes.
Yeah.
If you're a good candidate, someone with gaps but healthy teeth, this restores your ability to chew on both sides of your mouth, and that balance is so important.
Okay, so that's the partial path. Save the neighbors, fill the gap. Now let's pivot. Full dental implants. Who is this for?
This is for patients with severe tooth loss, or maybe someone whose remaining teeth are just so damaged by decay or trauma that they really can't be saved. We're talking about replacing an entire upper or lower arch.
A whole row.
Whole row.
Now, does that mean if I need a full arch, I need a separate screw for every single tooth? Like 14 implants for 14 teeth? That sounds like a lot of surgery.
That's a very common misconception, but no, that would be surgical overkill. The engineering is smarter than that. Dr. Poles typically uses 4 to 6 implants to support a full set of replacement teeth.
Oh, wow. So just 4 posts can hold up an entire row of teeth.
It's all about the angles and the placement. Think of it like a bridge. You don't need a support pillar under every foot of the road. You just need them at critical structural points to distribute the weight.
That makes sense. Physics doing the heavy lifting, and the source talks about this being a transformation.
It really is, and I don't use that word lightly. When you lose an entire arch of teeth, your face can actually change shape.
What do you mean?
Well, without the teeth and the bone to support the lips and cheeks, the lower third of your face can sort of collapse inward. It can make you look significantly older. Full implants restore that vertical height. They restore the facial structure.
And your speech, I imagine?
And your speech. Absolutely. And obviously it lets you eat real food again.
There was a detail in the source that I found interesting about bone grafting. I feel like whenever people talk about implants, they get scared of the words bone graft.
It's a valid concern. If you've been missing teeth for a long time, the bone shrinks. In the past, you'd almost always need a graft to build it back up. But the source notes that modern techniques, specifically that angled placement we just touched on, can often reduce the need for it.
So they can angle the implant to find the good bone that's still there.
Exactly. By tilting the implant, they can anchor it into denser bone that might not be available if they went straight down. It's less invasive and can speed up the whole timeline.
Okay, so we have partials for gaps and fulls for the whole arch. How does a patient actually make the choice? Is it a preference thing?
Not really. The source clarifies that the choice isn't really a preference in the way you might choose a car color. It primarily depends on the clinical reality.
How many teeth are missing? What's the health of what's left?
Exactly. Preservation is always the goal. But There are other factors mentioned: cost and time.
Right. Let's talk about that, because this is an investment.
It is. Partial implants, they generally cost less. It's just math, fewer implants, less surgical work. Full implants involve more planning, more materials, and a higher upfront cost. But the value proposition is that it delivers a complete transformation, a clean slate.
And maintenance. Do you have to take them out and scrub them?
No, they're fixed, remember. Both options require what you'd expect for natural teeth.
Yeah.
Regular dentist visits and daily care. Brushing, flossing, you know the drill. But the key takeaway from Dr. Poles is that both options feel closer to natural teeth than any removable alternative ever could.
It's about getting as close to original equipment as possible.
That's a great way to put it.
So let's say I'm listening to this, I'm in Schaumburg or Des Plaines, and I'm thinking, okay, I need to do this. What's the actual experience like at Omni Dental? Because surgery is surgery. It's scary.
It is. But the source outlines a very structured journey. It starts with a full exam and imaging. They need to see exactly what's going on under the gum line nerves, sinuses, bone density.
They need a map before they start driving.
Precisely. Then comes the surgical insertion of the post.
And then this is the part people forget. There's a healing period. It mentions months. Months. That feels like a long time to wait.
It requires patience, but remember that biological bonding, osseointegration. The bone needs time to grow around the titanium. You can't rush biology.
So you're investing that time to make sure it lasts forever.
Exactly.
Huh.
Once that's healed, step 4 is the attachment of the replacement teeth. That's the finish line.
And about the scary factor, the source emphasizes comfort. They talk about a relaxing environment.
They do. But more importantly, they talk about using advanced technology for precise diagnosis and conservative treatments.
I saw that phrase, conservative treatments. What does that actually mean in dentistry?
Conservative means they want to do the least amount of invasive work necessary to get the result. They aren't going to drill away healthy tooth structure if they don't absolutely have to. It aligns with their whole philosophy.
And the payoff for all this? Longevity.
This is the investment angle. The source highlights that with proper care, implants can last for decades. This isn't a patch job. It's a long-term solution.
Decades? That's potentially the rest of your life.
It really could be.
So, bringing it all together, whether it's full or partial, Dr. Poles and the team at Omni Dental seem to be saying the same thing. This is about restoring function.
Function and confidence.
Yeah.
It's about being able to eat a steak or an apple. It's about smiling at a family photo without, hiding your mouth. It's a life-changing solution, to quote the text directly.
And if you're in the Arlington Heights area or any of those communities we listed, Wheeling, Elk Grove Village, you don't have to just live with the discomfort.
You really don't. The technology is there. The expertise is there with Dr. Poles.
So if this is resonating with you, here are the details you need. The practice is Omni Dental and Med Spa. Their phone number is 847-483-8833. That's 847-483-8833.
And you can obviously book online these days.
Yes, the source mentions you can book an appointment or schedule online right through their website. And a crucial reminder, Dr. Poles specializes in emergency dentistry. So if you are in pain right now, you don't have to wait. They handle immediate needs.
That is vital info. Don't just sit in pain.
Before we wrap up, I want to leave our listeners with something to think about. We talked about the mechanics, the titanium, the bone bonding, but there was a small tag in the source material that caught my eye. It mentioned heart health.
Ah, yes. It's a profound connection that we often ignore. We treat our teeth as if they're separate from our bodies, like accessories.
Right.
But think about it. Chronic inflammation in the gums is linked to heart disease. And if you can't chew proper food, fibrous vegetables, healthy proteins, your nutrition suffers tremendously.
So if an implant preserves your jawbone and lets you eat nutritious food again?
Then a dental implant isn't just a tooth replacement. It is arguably a whole-body health intervention.
That is a powerful way to look at it. It's not just about a pretty smile. It's about fueling your entire body.
Exactly. Everything is connected.
Well, on that note, we're going to sign off. Thank you for listening to the Omni Dental Podcast.
Goodbye, everyone.